welcome everyone again. Um, my name is Shirley, and I will be your moderator this evening. Tonight's webinar is Decoding PPO Problems to Boost Practice Profitability. I am excited to welcome Dr. Jim DiMarino, CEO of Practice Booster. He's a patented inventor, a trainer, educator, publisher, and lecturer, and his contributions have left an indelible mark on the industry. With over a decade of experience in the dental insurance sector and serving as a trusted consultant, Dr. DiMarino brings a wealth of knowledge to our discussion today. So we're pretty excited to hear what he has to say. Before we get started, I would like to take a moment to go over some quick housekeeping things. If you have a question, we'd love if you could please type it into the Q&A box. And please type them in as they're coming up for you, because we're going to address them at the end of the webinar. But get those questions in there. And CE is not available for tonight's webinar. Also, anyone who registered will be receiving a link with the registration. Okay, with that said, welcome Dr. DiMarino, and thank you for being with us. I will pass it over to you now.
Great. Thank you so much for having me, Shirley. I appreciate the kind introduction. And I want to welcome everybody to what I hope is going to be an enlightening 45, 60 minutes here, and kind of digging into the PPO, but also understanding how to increase collections and minimize claim denials without fighting insurance companies, hiring more staff, or sitting on hold all day. I know that's something that we all deal with when we're talking about payers. So we're going to dig into a couple of different things. The second part is decoding the PPO problems, decrease claim denials, and increase collections. And as Shirley mentioned, I'm Dr. DiMarino here to walk you through the next dozen slides or so. So having said that, I am not a lawyer. The information that we're providing today is not legal or tax advice. So if you have such questions, please consult your healthcare attorney. And as always, we encourage you to code for what you do. So let's kind of dig into this and talk a little bit about what we can expect over the next couple of minutes here and short of an hour. So big questions, are you ready for 2025? One of the things that we do at Practice Booster is we do the work for you. We're going to look into the code changes that occur every year, which I didn't know about until I was practicing for a couple of years. But every year the codes change. There's the Code Maintenance Committee meeting in March at the American Dental Association. And they talk about the different codes and how they change. Well, what we're going to do is we're going to help you learn about those code changes and summarize them for you. We have a code guide that is going to be given to you at the end of this presentation. This is to encourage you to stay with the program, and at the end you're going to get access to this important code guide. Discover the 46 new CDT code changes or additions just in the past 3 years. But I also want to summarize, since 2020, there have been over 200 code changes. And the reason I bring that up is these are not inconsequential code changes, right? So these changes will impact your bottom line. And it's something that I never really followed. But now that we're with this amazing team at Practice Booster, we're going to provide you this summary at no cost to you. And again, at the end of this presentation, I'm going to share a QR code so you can download this critical resource. You're going to learn about the 46 new CDT codes, the 28 codes that have undergone crucial revisions, and it's going to help your office stay in compliance with coding guidelines and help reduce claim denials. So stay tuned to learn how to download it for free. As I mentioned, that's a special thank you for staying with this program and something that you'll find invaluable. So having said that, what are we going to cover today? And what we're going to cover today can truly change your practice, not just today, but going forward. So what we want to do is eliminate any distractions so that you can learn these crucial steps. So if you're multitasking, I get it. I know we're all so busy. I know you got phones and kids and grandkids or, significant others, all those things. So just try and take some time to grab a pen and paper and just kind of sit back and jot down some of the things that I'm going to share with you tonight, because if you do, I promise you, you'll find at least one pearl that you could put into place tomorrow that could significantly impact your practice and help you capture some of that lost revenue. So as I mentioned, I'm Jim DiMarino. I'm a graduate of the University of Pennsylvania. I am a former dental director, right? So why should you listen to me? Like, what do I have to offer you tonight? Well, I used to work for a dental insurance company. In fact, I was a national dental director for 6 years. And then I was also a claims reviewer. I'm a certified dental consultant, and I'm also the CEO of Practice Booster. So what does all this mean? It just means that I get to travel around the country and help train and teach other dental team members on the mistakes that I've made, essentially, so that you don't make them. And our commitment at Practice Booster is following Dr. Charles Blair's legacy. We've got an amazing team with Dr. Greg Bromeyer, Tiffany Ammer, Julie Denise, Amanda. I mean, we've got Jacqueline. It's just an amazing team that we've got, and Mason Blair as well. So Fran is here to help us. So all of us are here to do the things that are difficult to do for each of us in clinical practice. So I want you to imagine a future where claims denials just disappear. Isn't that a nice thought? So we're going to help you get there. So when you go to bed tonight, I'm hoping you get a great night's sleep. You're going to dream about all that money that you've earned that you're going to start to collect. And what I mean by that is you've already done the work. You've already put in the time to learn how to do all these amazing procedures, to hire the right staff, to hold on to that staff, which I know is a difficult thing these days. But if you don't get those claims paid, or if they get denied, then for me, it resulted in a lot of restless nights. So we want to remove that for you. We want to help you have little to no claim denials, increase collections, and reduce stress. And we want to have a streamlined and efficient workflow for submitting every claim. That's what we're going to start with. And what are we going to cover today? Well, we're going to boil this down to 3 secrets to increase collections and minimize claim denials. The number one mistake most practices make that leads to claim denials, and then how you can avoid it. Why you don't need to be a billing expert to stop losing money on denied claims. And lastly, the little known strategies to outsmart insurance companies and get your claims approved faster. Or a better way to say it might be to provide the insurance companies with the information that they need so that they can pay your claim first pass, right? The first time they see it. That's the goal. So let's start with the secret number one. The number one mistake most practices make that lead to claim denials. And then we're going to talk about how to avoid them. So by starting there, I'm going to also start with a story about my practice. So the first time I learned about dental codes was when I was in dental school. And as many of you probably remember, you had certain requirements that you had to complete before you could graduate. A certain number of crowns, implants, dentures, partials, all those types of things. Well, it was hard to find the patients that needed those procedures. So when you found them, it was really, it was a gift, right? So then you're like, okay, now I've got to figure out how to do this. I've got to read up, I've got to study up, I've got to get my skills down. I didn't realize that at the time, this was 1996, right? 1995, my school required that I collected the money from the patient, but then also collect the money from the insurance company. Now, I had no idea what an insurance code was. So that's when I was first introduced to insurance codes. And when I figured out that I needed to get it paid, I had to figure out how to go to the insurance department, figure out how to get this submitted. And what are these things that we have to submit to the insurance company? Why do I need to submit an x-ray? Why do I need to submit a narrative or periodontal charting or whatever the case may be based on the code? And each code has a specific set of requirements. So that's when I was first introduced to codes. And then I went into private practice, and it looked like we were busy and successful, on the outside. But it didn't take long for me to figure out that I didn't know what I was doing on codes. I had a practice where after my residency, I started working as an associate in a couple of offices, and then I got a call that a dentist in my area had to go into the hospital, so I started covering for him, and he decided to retire, and he was going to mentor me, but decided to retire instead. So I was just thrown right into it. So I was trying to go from, a 1 hour occlusal composite down to, 30 minutes or 20 minutes or whatever I could to try and increase efficiency. but our over 90 AR ballooned to over 250,000. Why? Because our claims were getting denied. We didn't know what we were doing up front, and I didn't know who to hire. I was brand new. So this was an error that I was making and didn't know how to fix. So instead of preventing errors, I learned from the denials so that now I'm coming here to help you so that you can know what to do before submitting the claim. So that's the key, right? I can't take a pre-op x-ray after I submit the crown, right? So if insurance companies need these requirements before the procedures are done to get the procedure approved, then we need to know those things before the claim is being submitted, or in some cases, even before, in many cases, before the treatment is even rendered. So that's the story. That's why I'm here, and we're going to share all that knowledge with you. Now, in my second life as an insurance dental director, I was the one you called when you had complaints. I want to speak to that dental director. Why are you denying my claim? How can you dictate treatment? Are you even a dentist? How can you tell me how to treat my patient? I've heard a lot of it, and some of it wasn't very pleasant. But what I'm going to do is bring some of those secrets that I've learned to you tonight. And here's the one that I find most often. If I were to ask you, how many of you think that insurance companies deny your claims just so they can keep your money and gain interest on the money they should be paying you? I've heard that so many times. Truthfully, the insurance companies, if they're going to pay that claim, they want to pay it the first time they see it. And that's what we're going to discuss today. How can we position your claims in a way that when the insurance companies look at it, they're going to pay it first time because it has the right narratives, it has the right attachments, it has the right x-rays, it has all the requirements that that AI in the insurance company's portfolio is going to review and say, I'm passing this through to pay. So what's the goal of insurance? The goal of insurance, like I said, is to pay a claim first pass if they're eventually going to pay that claim. But they're not going to pay it unless we provide X, Y, and Z. Well, where do we find out what those requirements are? That's what we're going to talk about today. Now, the challenge is that over about 25% of claims submitted are likely to be denied or at least reviewed by an insurance carrier. Well, when that happens, there's a greater chance of delays or denials. And the number one reason payers deny claims is due to incorrect coding or insufficient documentation. Well, if we knew what the coding was initially, or if we knew beforehand what documentation, what the proper code is to use, then we can eliminate that objection and hopefully get your claims paid first pass. But when I was practicing, I never had the resources to tell me which claims were going to get approved or denied, right? The insurance companies have that information, but the providers don't have it readily available to them. Plus, you're working with most likely more than one insurance carrier. So it could be different, and a lot of times it's different based on the insurance carrier and the payer. So those are the things we're going to look at today. Now, the challenge is most practices are not prepared for 2025. And I don't want to, the problem with that is we're also not prepared for 24 or 23. And when the codes change, how do you know they change? And how do you know how to implement those changes and which ones could be beneficial to your team? So each year around this time, it's a good idea to start looking into the changes that are going to become into place next year. But wouldn't it be nice to have a resource that automatically did that for you? Right? Because that's the key. If there's a resource that did it for you, you wouldn't have to know that there's 46 new code changes in the last 3 years, 28 revisions, 4 codes have been deleted, and how many of your denied claims have been submitted this year that could have been prevented if you had known that? So coding errors lead to denied claims and lost revenue. As I mentioned, if 25% of claims are denied on an annual basis, and only 33% of those denied claims which are appealable, and if you did appeal it, most likely would have been paid, they're not, only 33% of them are actually appealed. So when you look at that number, that's a staggering number. So let's, on average, say that you're, just to make it easy, you have $1 million practice. That could be up to $250,000 that's in limbo, or that you could be losing each year. basically just because you weren't sure of which codes to use, or they may have been submitted incorrectly. So why are denials and coding errors happening so regularly? Well, most of the time it's because dental teams don't have the resources they need to submit clean claims. Now, I don't know about your offices, but I'm seeing more and more offices having struggles retaining staff. This gets even heightened when there's staff turnover, right? So all of these things come into place that cause us stress and frustration. The idea here is let's find a solution that's going to help us pull these pieces together and find that one that's missing, right? So if codes change each year, and there's been 200 code changes since 2020, can that lead to frequent claim delays and denials? Absolutely. And what's the cost? Well, we saw it could be quite substantial. Next is claims are constant. We're sending claims out every day. Is your dental claims team, are they up to date on those changes? Are they staying on top of the ones that are denied and reviewing them so that you appeal the ones that are appealable and that should be paid, or are they just getting written off? And what's the solution? Well, every dental practice is missing a key resource to the submission process, and that's what we're here today to discuss. We want to know something, we want a resource that tells them which codes to avoid, which ones to include, what documentation is needed, and how to submit that claim, and maybe even the narrative. So what I'm doing tonight is I'm introducing you to Code Advisor. Now, this is the world's most comprehensive CDT code database, a resource that every practice needs to prevent claim denials. It's being relaunched. Actually, last week we relaunched it in a brand new format. We have a mobile-friendly version. We have a web app that's coming, a mobile app that's coming out next week. And what it does is it provides expert coding error prevention so that you can prevent claim denials before they happen. We have an AI-powered search so you can find exactly what you're looking for. We have documentation requirements so that you can know what x-rays, what narratives, what periodontal charting, what documentation is required to get that claim paid. And lastly, those narrative guidelines. You only get 80 characters in the remarks section, box 35 of the claim form. What are those key terms that you need to put into that narrative so that when the AI reads it, it has the best chance of getting paid first time? So what we're really excited to do is show you how claims, the new Code Advisor, what the workflow looks like and how it will actually prevent coding errors, right? So let's take a little peek and let's kind of dig in here. So when you log into the website, you actually enter a keyword or you enter a code, whatever. You could type in all on X. You could type in anything, that a keyword, a phrase, what you're looking to code for, or the code itself. And once you type that into Code Advisor, you hit enter or search, and you get the information provided from this valuable resource. So the first part, as you see, we pay a royalty to the American Dental Association. We've got the code, the nomenclature, and the descriptor, right? D0120, periodic oral evaluation. And then that first section is in every code. So you're always going to get what the ADA provides. And the reason we do that is that's the home, right? That's what we all are looking for. But we also have more information. Now, this is information that comes from the ADA. This part is what comes from the years of Dr. Blair's experience and our Practice Booster team's experience. This is when we answer your coding questions, and as we're doing our research, and as the codes change, we update a warning section. Now, the warning section is really important because this tells you information about a code that you might not know. Now, when claims get denied and we work with insurance carriers, we start to understand when claims might be denied or some common coding mistakes. And we're going to highlight those for you. So in this case, in the warning section, a lot of our clients, when we do revenue enhancements, where we look at your fees and we help you get your fees to the average for your zip code, we use 3 different sources of fee data to do that. We analyze your fees, we analyze your coding utilization, and we provide you with the 75th, 85th, and 95th percentiles for your area. And then we look at your coding and we see where you might be making some coding errors. And on average, what we're finding is dental offices are using anywhere from 3 to 5 deleted codes and over 20 custom codes. Anytime you submit a deleted or custom code to an insurance carrier, it's going to get denied. So what we do is we take all that information and we bring it back to the code advisor and we update it. And what we're finding is that a lot of offices are not conducting an oral cancer screening when they perform a D0120. So we added that to the warning section. The periodic oral evaluation 120 includes an oral cancer evaluation. The fact that an oral cancer evaluation was done and any significant findings should be documented in the clinical notes. These are the warnings and the tips that you're going to get for every code. And it's really important for your legal document to make sure that you have that handy and it's recorded in your clinical record. Now, what's a watch section? Let's look at that one. The watch section tells you things that you might want to watch out for. Now, here's one we see often. Oral evaluations may be reported in addition to a 4910, the periodontal maintenance, when completed, right? This is something that we see offices are not doing. What does that equate to? Well, that equates to lost revenue. So our goal is to code for what you do, help you code for what you do. But by coding for what you do, you actually enhance your clinical record, your legal documentation, but then you also are able to increase your billing ability, right? So that's what's the nice part about all this. We're going to teach you how to do the right thing, and often the right thing also can result in preventing denied or delayed claims, but in some cases can also result in increased revenue. So the next section talks about comments, and then we have a section on limitations. And limitations is a really important one because now we're looking at insurance carriers and we're saying, you know what? A 120, as with all evaluations, is typically subject to 2 evaluations per year or 1 per 6, right? 1 per 6 months. These are the limitations that are assigned to this code. Now, they're established by the plan documentation. Now, however, some payers will reimburse for a third oral evaluation when performed in a different office or if there's an additional problem-focused oral evaluation during the limitation period, right? So that's when a D0140 might come into play. But as you look at this, you can see how we have all these other codes that are embedded within the code advisor. These are ways that you can learn about limitations and you can learn about how to apply a code and when you might want to apply a code and when you might not want to apply a code. And I'm going to talk about this a little bit later because there's a lot of tips and tricks on how to properly code, as I mentioned, that also can help increase your bottom line. So the last part are the tip section. Now, in this case, the tip section is, hey, let's talk about what other things might be of interest to you that we've learned over the years that some offices aren't doing, right? So you can read this yourself. The periodic evaluation includes periodontal screening where indicated. Now, the challenge is sometimes a screening can turn into a 6-point probing, which is a complete periodontal probing, and that can turn a 120 into a 180. And I'm going to talk a little bit more about that later, because what we're finding is that a lot of offices don't bill out for a D0180, and they're leaving money on the table when they may also be doing a 6-point periodontal screening, periodontal charting, but only billing out for a 120 or maybe even a 150. So these are the tips I want you to keep in mind. Now, having said that, I can imagine your mind turning here, and some already know this, which is great. And this is just the basic codes that we're going to be talking about. But if this opens your eyes to some of the evaluation codes, you can imagine how much more detail there is when you get into more complex coding. So that's what's exciting about this opportunity to explore Code Advisor with us. Now, here's an example of narratives. The 4346, the moderate to severe gingivitis code. We include expert suggestions that will outline what you should say on the claim with specific type of documentation and x-rays and what should be included. And the narrative in this case, it talks about 3 things: periodontal charting, photographs, radiographs. It even gets into clinical evaluations with diagnosis of generalized moderate or severe inflammation. These are things that you might want to put into your claim form. Now, what's nice about this is you can actually scrape that, copy it, and then paste it right into your, your Dentrex system, your practical management software system, your claim form. We're doing the work for you so that you can take this information and then customize it for each patient. It saves a lot of time and it puts it at your fingertips. Now, this isn't all it does because we have detailed flow charts. Now, we created this flow chart in conjunction with the American Dental Association. We always work very closely with the American Dental Association. But these are questions that we get a lot. How do I know when a 4355 applies? When can I do a 120, 150, 180, 140? How does that come into play with the 4346? And then what about scaling and root planing? This chart alone, if you took this and had one of your office meetings and you said, okay, we're going to go over our perio maintenance program in our office. We're going to put our system in place to follow this flow chart. Number one, it enhances your documentation. Number two, it opens the door for the enhanced coding opportunities, especially with the 4355 that we couldn't do before. We could never do an evaluation with a 4355. Now you can. That's a coding change that we're researching for you. All of these are at your fingertips for each code. Now, having said that, how many codes are there? Well, there's over 875 codes, right? For you to do this for each code would be a monumental task. It is for us, but we've got a team that does this for you. And what we're talking about is every code provides you this valuable information so that you have it at your fingertips and you don't have to learn on your own. In fact, we're bringing you the collective knowledge of over 30 years of experience, and then doing revenue enhancements every day with our clients. We update these systems so that we're providing you the most current information. So that's secret number one. Now, secret number two, why you don't need to be a billing expert to stop losing money on denied claims. Well, you may be thinking, we've been billing insurance for decades. We already know all these nuances, and that's great. If that's the case, more power to you. We're happy for you. But there's a lot of offices, as is mine, like we get confused, especially when these new changes come out. Now, whether you or your insurance coordinator have 10 years of experience and submitted claims for years, and the challenge is that these codes change. And can you stay up with those code changes? As I mentioned, over 870 codes. What we're finding is most dental offices use anywhere from 60 to 120 codes. And that's it. What that's telling us is that you might not be using all the codes or the ones that are most valuable to your practice. And that's what we do in our revenue enhancement program. We look at your coding utilization and we say you're only using 60 codes. If you expanded and included these other 15 or 20 codes, you could increase your billing by this much. And what we're telling you is not to do new procedures. We're just telling you that the current procedures you're currently doing might be coding incorrectly, which causes you to leave money on the table. So the nuance to each CDT code is more than even the most experienced biller can remember alone and relearn each year. Now, you also may be thinking, well, this seems good, but is my team really going to do that on every claim? Are they going to look up every claim? I'm skeptical that they'll adopt this new process. And I understand. Now, the challenge is, Dr. Blair used to say, we only have to, invest our time in learning the codes that we want to get paid for, right? So as a provider, I want to get paid for every code that I do. I want to get paid for the treatment, and I want to be able to do the charity work when I want to do the charity work and when I choose, not when, unfortunately, we didn't code correctly and the money doesn't come in. So while the data we've shown proves they should do it, they certainly will get more experience over time, especially with the more common codes that are being used. Now, it's easy to search for what they're looking for because it's not just based on code numbers, but categories and keywords and phrases. And what I want to share with you is that the resource that we're providing is a resource that the dental insurance payers already have on their side. And when you submit a claim, they're using that to screen your claims, and then are also programming that into the in artificial intelligence so that it's looking for certain things. Wouldn't it be a good idea to use the same resources to submit your claims with the same criteria that the insurance companies are using to review your claims? And that's what we're offering you. All right, will they need to change their processes forever? And will this slow us down? Now, it makes sense. Anytime you implement something new, you're going to be more careful, right? You're going to be on the slower side. And as you get more comfortable and as you start to pick these nuances up, the warnings and the tips and the tricks and all the things that we've already programmed in there for you to reduce that learning curve, you're going to get faster and you're going to be able to optimize this process for your office. Then as your team starts to educate themselves, they're going to become faster and spend less time, especially on the more common codes. And then as the denials decrease and reimbursements increase, the extra time spent making sure clean claims are submitted will definitely make up the difference. And it's so much easier to get paid, spend a little bit more time to make sure the claim is submitted correctly so that it gets paid correctly than it is to have that claim come back delayed or denied. And then you have to decide, do I appeal this? What information do I need? What did I miss? All that causes more time and more frustration. Let's help you do that work on the front end. And the good news is we're going to program the system to help you by understanding the nuances that we find, so that helps to reduce that learning curve for yourself. Okay, secret number 3, the little known strategies to outsmart insurance companies and get your claims approved faster. Now, I like the title, but it's not so much outsmarting, because what we're doing is we're being as smart as. And what I mean by that is these insurance companies have clinical guidelines that they have to review before they can pay your claim. And if A, B, and C don't match up, they cannot pay your claim as much as they may want to, right? So if we know what A, B, and C are, and we program that into CodeAdvisor for you so that you learn from all of the things that we learn from, now we've got a collective document that helps you get these claims paid much, much faster. So you may be thinking that PPOs are still just going to deny my claims, even if I try my best and use this information. Well, I hear this a lot. And I hear, oh, I submit documentation to these insurance carriers and I send pages and pages, but it doesn't matter. Well, what matters, the only thing that matters is you match your A, B, and C with their A, B, and C. If you're submitting D through Z and it doesn't ever cover A, B, and C, then you could be doing all this work to get your claims paid and it's not going to matter. So we're going to help you understand what A, B, and C has to be for each of the claims, because on the insurance company side, they've got these AI bots and they're looking for A, B, and C, right? If you provide A, B, and C, auto-adjudicate it. And that's where the narratives and code tips that we provide will help minimize the common denials caught by insurance AI adjudicated claims, right? So that's where CodeAdvisor comes in. We're your shield. We're the ones programming this product for you to reduce your learning curve and to increase your efficiency. So here's a great example. So let's talk about some kind of insider techniques that help you maximize your reimbursement. One of the things that we found over and over again when we do our revenue enhancements, and we've done, I don't even know how many. Dr. Blair's done these for the last 20 years. Dr. Greg and our team's been doing these for, every month we do dozens, and now we're even increasing that. So we're looking at how you're coding, and we're finding that very few offices fully understand how to code for a D0180, a comprehensive periodontal evaluation. So they're reporting a 150, a 120, and sometimes a 140 instead of a 150. Now, if you report a D180 instead of a 150 on qualified new patients where periodontal records are taken, you can increase your reimbursement and get paid for the time that you're devoting to taking care of the patient appropriately. And the same for a 120. So what does that look like? Well, let's look at CodeAdvisor. In the warning section, it says, do not report a 180 in addition to the comprehensive oral evaluation, the 150. We get that a lot. on the same date of service. However, the general practitioner can always report a 180 provided the patient exhibits signs and symptoms of periodontal disease or risk factors such as smoking or diabetes. That's a critical statement. And if you understood how this works, you would be able to apply this to your practice. Now, some of you are doing this beautifully, but when we look at your utilization reports, pull your numbers tomorrow. See how many 180s you've done this past year or even this past month. If it's 0, if it's 5, if it's 10, chances are you might be underutilizing the D0 180, or your office is doing 6-point perio probings and you're billing out for a 150 or a 120, which means you're getting less reimbursement for doing the 180 and you're not completely documenting correctly. And these are those tips. A D0 180 is more detailed and includes a 6-point per tooth probing, full mouth charting, and then it goes on to identifying furcations, wear for sets, all these different things that you want to make sure that you're made aware of. But what's the bottom line here? Well, the D0 180 can be reimbursed 10 to X dollars more than the 150 and even more than the 120. And that's what we're talking about. You may already be doing the correct work, maybe treatment planning your patients correctly and doing the correct periodontal charting, but you might not be billing out for the 180, or it might not have changed from the back end when the person, the hygienist and the dentist talk and they're like, now we got to do a 6-point probing, but that doesn't get communicated to the front desk, and then it gets billed out as a 120 or 150. We're finding a significant amount of money being left on the table just in this one scenario. How about emergency visits? Here's another great example of reporting a 911 if a minor procedure is performed to relieve discomfort instead of a 140 maintains evaluation reimbursements for periodic exam visits. If you remember, I showed you a snippet from the 120 where it talked about the frequency limitations. Well, 120, 150, and 140 typically share frequency. If you bill out a 140 instead of a 9110, you could be impacted when that patient comes back for a cleaning, and now they say the evaluation, the 120, was denied because of frequency limitations. Now the patient has to pay out of pocket, it gets uncomfortable. If that's ever happened to you, this may be a code that you should look into. Now, the difference is a 9110, think of that like 911. It's an emergency, right? That's the doing code. 911 means you actually did something. You smoothed off a cusp. Those types of things. If somebody comes in, they have a broken cusp and they're biting and their chips, their tooth or their cheek gets inflamed, you smooth off the cusp, that's a 9110. The 140 is the observing code, right? That's the difference. Or writing a prescription, that could be a D999 or a 140. So what we're talking about here is if you pull up the 9110, it says D is not reported when only writing a prescription. And this is what we see a lot. A lot of offices say 9110 for writing a prescription. That's incorrect coding. You have to do something. A 9110 is reported when the patient is treated in some way to alleviate discomfort. And what's new is you can now put a 9110 on the same claim form as a 120 or a periodic visit and cleaning. So say, for example, a patient comes in and they're there for their cleaning. And they say, you know what, I broke this tooth. It's really hurting me. Can you smooth it down? Now, we've been doing this for years. We smooth it down, but we never build out for 9110 because before the code change, it was you can only do a 9110 if that's all you did. Well, that has now changed. If you look, you don't see that any longer. You don't see that anything in the documentation saying that you can't do it in conjunction with another procedure. So now you can add a 9110 to that periodical or evaluation and cleaning. And in the narrative form box, 35, the remarks section, you write patient presented with pain, smooth distal buccal cusp with tooth number 14. And now you're going to get 9110 on top of your other evaluation and the cleaning. So these are the code changes that turn into dollars because you're doing the right thing for your patient, but now you're also getting reimbursed for it. These are the tips that are included in Code Advisor. So I know I'm throwing a lot at you. I know we don't have a whole lot of time, so you may be feeling a little overwhelmed. And that's okay, because you're not alone. In fact, a lot of our clients that we talk to feel this way. And when we share Code Advisor with them, they get such a relief because they don't have to do all this work. And when they're finding the scenario, it's as if we're speaking right to them. And as you're reading through it, you're like, that's exactly what I needed to know. Now I know how to code for that patient. And I'd like to make you a special offer tonight to help you kind of ease into this and feel like you're going to make some progress and that there's a good resource out here for you. I know that we can help you solve these claim problems because we've all been through it. And we do this every day and we're learning from all of you. And that's how we update this system to make it the best that we can so that we provide that information to you. So what does this look like? Now, we want to get you 12 months access to this Code Advisor tool today, right? What it's going to do is help you prevent coding errors. It's a comprehensive CDT code database. Its AI-powered search will help you find the codes that you're looking for, and it's going to help you increase collections while decreasing denials. Now, what's nice about this is you put it on your system in your office, and your office, anyone in your office can use it, and it's a $600 value. So what else are we going to offer to make this even better for you? Now, we get thousands of questions a year on everything you can imagine. How to code for complicated procedures like implants, full mouth debridement, bone grafts, all on X, right? These are the things that you're dealing with every day. We get those questions. We have questions that come into us. We answer those. And we also get PPO related issues with like deductibles, out of network benefits, coordination of benefits, and much, much more. That's why we created this tool. We take all that information and we pack it into this tool for you. And then we publish them in insurance newsletters. Every other month, we come out with a newsletter that captures one of those, well, several of the common coding questions that we get for the 2 months that we collect them. And we provide it to you so that you're getting cutting edge information on the problems that affect most of of your colleagues, right? So every other month we send this to you and your entire team. We print 6 out each year, but with this special offer, you're going to get a 3-year archive. So you're going to get 18 of these so that you can search back and look through all on fours when we published it in 2022. Now it's all on X's, right? And we have a new version coming out in 2024, things that we update so that we constantly stay on top of the information so that you don't have to go searching for it. Now we cover PPO and coding issues like HIPAA, ICD-10, and Medicare compliance. We have subject matter experts who provide guidance on dental practice administration and much more. So this isn't just for codes. This is also talking about all those things that you're experiencing that front desk, your administrators and your dental team. Now, this has a $1,200 value in and of itself, right? So what's exciting about what we're going to do tonight is we're going to take these and put them into a product for you so that you have one place that you can go and access all these resources. Now, there's still more pitfalls in the dental process. In addition to coding and PPO related questions, there's still so much more to be answered. What steps do I need to take clinically? What record keeping practices do I need to adhere to? What forms should my patients complete? We get that all the time. Well, we have a dental administration resource center where we've got flow charts for clear decision making on procedures and coding, like I shared before. We also have sample letters, forms, and checklists to enhance practice operations. And I want to point out, I showed you one flow chart. We've got many flow charts about different codes and how it should be navigated through your practice. They're great for, like I said, having a lunch and learn, having your office meetings, going over certain one of these. You can pull one out each week, go through it, enhance your practice understanding. We've got narrative tips for effective claim submissions to help maximize reimbursement. It's critical. AI is looking for A, B, and C. We're going to help you understand what those are. We're going to help provide you with narrative suggestions that you're going to customize for your patients, and then hopefully get those claims paid first time you submit. We have a Q&A database answering common insurance questions instantly, and that's values $1,200. Now, what are you going to get with Code Advisor? Well, we already talked about the 12 months of Code Advisor, the online database. That's worth $600. We also talked about the insurance newsletter. That's a value of $1,200. And we also talked about the Dental Administration Resource Center. That's a value of over $1,200 as well. So now we're up to almost $3,000. Now, if I said all this did was to save you 3,000 in denials, is it worth it? Right? If it's when you think about denials, you have to also think about the time it takes to deal with a denial. And the 33%, I should say, that get appealed, and then the 67% that just get written off. Guarantee there's more than $3,000 in that equation. Well, luckily, the price won't be $3,000 tonight. And that's on purpose because we know how hard it is to be in the dental practice and deal with all these things that you're dealing with. So today, we're going to take that down to $479 for the year. And the way you can take advantage of that is go to dentalcoding.com/go or click that QR code and you can sign up tonight or tomorrow or whenever it's convenient for you. The goal here is to provide you with all these resources. Let us do the work that we are committed to doing every day, understanding what common questions and problems that you're experiencing, and bringing these solutions to you so that you don't have to go and research these yourself. You get the insurance newsletter, 18 issues. You get 12 months of Code Advisor where you can type in the keyword, the phrase, the code. You can learn about the limitations, the flow charts, the narratives, the warnings, all those things that we put at your fingertips. And then you get an admin resource center where you can print out documentation that you can share with your patients and your staff. All that has a value of $3,000, but we are reducing that to $479 per year because we're launching this new program essentially today. And we're excited to invite you to join us. Now, here's the deal. I know firsthand just how busy all of you are. It's too easy to let simple solutions pass you by. I want to make sure that the right choice is made for your office right now. So let me even sweeten the pot even a little bit more. I want you to fully implement this for your entire team and staff. The goal is that, as I mentioned, it's one user, 12 months. If we turn this into 5 users, now 5 users in your office can log into this system and take advantage of it. So now front desk, 2 computers at the front desk, 2 computers in the back, 1 person has it on their phone, whatever combination you choose, we're expanding this to 5 users. So essentially that's $3,000 because it's 1 user for $600, but the price is going to stay the same. So it's $479 to get all of that, not just for 1 user, but for 6 users. And the reason we're doing that is we're so excited about this, and we are so excited to carry on Dr. Blair's legacy. This was his vision, and we are just so grateful that we've gotten to the point where we're launching this new website. We're launching the app, and we want to provide this to you at a resource and a price that's hopefully going to make a difference for you. Here's the thing. Do you think any of this is going to save 1 or 2 claims from being denied or delayed? I could tell you the price of 1 claim or 2 claims will offset the price of this for an entire year. So if this helps you not get 1 claim denied or 2 claims denied or delayed, then you've already made money on this. And just think about how many times you'll access this resource to help reduce the amount of that 25% of production that's not getting collected. So really want to thank you for staying with me through this whole process. Now, I promised you something, and I'm going to stick by my word. If you scan this QR code, you will be able to download not just the 2025 code changes, but we're going to sweeten that even further. We're going to offer you the 24, 23. So the 23, 24, and 25 CDT code changes are available to you by scanning this document for free. No catches, no obligation. Scan the QR code, fill out the form. You will get this quick reference guide. I strongly encourage you to look at the 23, 24, and 25 coding change document summary, because if you're not up to date on these code changes, you're definitely leaving money on the table. If you feel like you're leaving money on the table, I would highly suggest you contact us at info@practicebooster.com to have us look at to consult with us about a revenue enhancement program. That's where we look at your fees and we look at your utilization rates, and we can tell you where you're undercoding, overcoding, and where you're possibly leaving money on the table. And I can tell you, on average, we're finding anywhere from $25,000 to $75,000 that offices are leaving on the table just by simply coding incorrectly. And what that means is, like I said before, you're using anywhere from 3 to 5 deleted codes, custom codes. All of that comes into play and causes you to have problems with, getting all the money that you deserve from the work that you're already doing. So in summary, here are the two offers. On the left is your free download. On your right is the 5-user limited time offer, where you can get 5 users for $4.79. You can see the value is extremely significant. What a drop that is for $4.79 a year. That's a year. We've never done this before. We're really excited about this. But this is a special offer to you. Thank you both. Thank you. I want to provide both these offers to you as a special thank you for being with me tonight. Again, revenue enhancement programs, if you're interested in that, we can do a free analysis for you. But reach out to us at info@practicebooster.com and ask about the revenue enhancement program. That's where we'll look at your fees and we'll look at your utilization rates to determine where you're leaving money on the table just by simply coding incorrectly. Now, I know we're getting close to time. I'll be happy to answer any questions anybody has, but I want to leave this screen up so that as we're answering questions, we are also giving those who haven't had a chance to take advantage of either of these opportunities to make sure you capture the QR code. So, Charlotte, thank you so much for having me tonight. I hope this was helpful. This is just the tip of the iceberg when it comes to coding. We've really just scratched the surface. And the part that I think I feel bad about the most, really, for most of our offices, is that if I were to say to you, I've got this great job, you get to work 10 hours a day, and you get to take care of some amazing patients. And the best part about this is you're going to go home feeling so tired. You're going to go home feeling exhausted. And then I'm also only going to pay you for 8 hours instead of the 10. How many of us would sign up for that job? The problem is the dentist is the one who has signed up for that job. The practice owner is typically working in 10 hours a day or more, but they're not getting paid for the 10 hours. They're doing the work of 10 hours, but they're only getting paid for a fraction of that, anywhere from 20 to 25% less than the time they're putting in. What we're here to do is help you capture the amount of time, capture the money that usually slips out of the bucket, kind of just falls through the cracks, simply because we code incorrectly. And that's why we put so much time into this valuable resource. That's why we're excited to offer this to you tonight. The price will go up, but we wanted to have this as an introductory offer so that we can share this with our friends who are the early adopters and really say a special thank you and carry on the legacy of Dr. Charles Blair. So, Charlotte, thank you so much for your time, and I appreciate it. If there's any questions, I'd be happy to answer them. If not, we can always answer the questions that come in, and if you can get them to me, I can certainly respond via email, whatever's easiest.
Oh, thank you so much, Dr. DiMarino. That was, that last anecdote was something that I was thinking as well. So thank you for making that clear and walking us all through how to not leave money on the table, especially by taking those steps to code correctly. And we'd love to get more questions in. So if you guys have any questions, please go ahead and enter them in the chat below. We do have one right now that's come in. This one is from In Park. Can we claim D9110 the same day we provided D0120 and D
Yeah.
11:10. I missed what you said. Another question.
Yes.
Well, let's go with that first, and I'll ask the next question.
Correct. So good point. Now the question is, if a patient comes in, you'll love this story. It seems to happen to me all the time. Patient calls you. They're like, I'm so sorry. I'm going to be late for my cleaning. If I'm 10 minutes late, is that okay? And you're like, sure, come on in. And my wife's my hygienist. And she looks at me. She's like, no, no, no. But we do it, right? We bring them in. And then when they get there, they're like, oh, I'm sorry. I got stuck behind a bus. They have all the stories. And then they're like, hey, while I'm here, this tooth seems, there's something wrong with this tooth. Can you take a look at it? Well, now you're 10 minutes down. And what do? You do it, right? You take out your high speed, you smooth down that cusp, and you don't bill them for it because that's what we've been used to doing because 9110, the 9110 was not able to be applied if you had any other definitive treatment. So what we're saying is in the 2023, so that change happened in 2023. So if you're not taking advantage of that, unfortunately, you've lost almost 2 years of being able to code for this. So you bill out, so patient comes in for the cleaning and the pro fee, then you bill out the 9110 and you write, you have to have pain in the remarks section. Patient presents pain, smooth distal buccal cusp number 14, something like that. Then you submit the 9110 in addition, and you get paid for it, which is great because we've been doing it anyway for free. And that's the thing. Now, 4355, I always get this question, and 4355 also changed. And the problem with 4355 was, as a dental director, I would get this all the time. Are you even a dentist? Are you even licensed in my state? How can I know a patient needs a 4355 if I don't do an evaluation? So how come I can't bill out for an evaluation when I bill out for a 4355? And I would say to them, you're right. But the ADA code says specifically X, and the employer who purchased the plan is the one who dictates how the insurer has to enforce the plan, right? So I couldn't approve it. So that has gotten removed. So now you can do an evaluation on the same day as a 4355, right? So those are the things that changed. Again, that changed in 2023. So if you haven't made that change in your office, those 2 points right there, if you just saw two patients, you've already, with maybe 3 or 4 patients, 5 patients at most, you've already paid for a whole year's worth of these tips and tricks. And that's what I'm trying to say, Shirley, is that these tips and tricks that we're finding for you, if you just find one that works for you, I want you to pull your 4346 tomorrow. How many times you've done a 4346 this year? How many times you've done a 0180? If both of those are less than 25% of the number of active adult patients in your practice, you're most likely or potentially underutilizing those codes. And we can help you figure out how to analyze that through our revenue enhancement program. But those are the things that we put into these resources so that you can turn that into proper documentation, proper treatment. And then, oh, by the way, you're doing the right thing and you're also making more money and you're not letting that money sip through the cracks and lose the money that you're rightfully owed. We're not telling you to do more implants. We're not telling you to do more crowns. We're just telling you get paid for what you do because you're coding for what you do.
Thank you, doctor. And then the next question, also from InPark. Another question is, if we claim D99.99, does the insurance pay for it?
Great question. It's so funny. Now, if I pull up D9999 in the code advisor, it's going to talk to you about each of the scenarios that we found, when it could, when it doesn't, and most of the time it doesn't. But there's opportunities on the 999 code that a dental insurance company has the ability to possibly pay you. So by not coding, here's the other thing, and I know we're almost out of time. By coding for what you do and using the codes correctly, you can also help insurance companies start to cover codes in the way that you need them to, because they're going to see the utilization go up. If we don't do that, they'll never start to cover these codes.
Thank you so much, Dr. DiMarino, and thank you for spending, again, all that time walking us through the different codes and the different ways in which we can eliminate leaving, money on the table. Thank you for a wonderful presentation. Again, we did record tonight's webinar, and the email with the link will be going out sometime in the next week. And we'd also appreciate your feedback via our survey that will go. That's going to pop up on your screens shortly. So thank you again, Dr. DiMarino, and thank you all for being with us tonight on this wonderful presentation. We look forward to seeing you on future webinars.
Thank you so much.
Good night.